My disorder is anorexia nervosa. Anorexia is an eating disorder that deals with an excessive amount of weight loss and having a hard time maintaining a healthy body weight. An effective symptom of anorexia can be through the fear of gaining weight. This could affect your health and lead to malnutrition or starvation, which could critically hurt your bodily functions. The fear of gaining weight is maladaptive because this could cause health issues and critical long-term consequences that can impact you for the rest of your life. Not being at a healthy body weight can cause physical harm to your body and threaten your life as a whole. Behavior symptoms like forcing yourself to vomit, extreme restrictive of food intake, or misusing supplements to suppress your appetite can be extremely harmful. These forms of self-harm will not only affect you physically, but could lead to medical complications later on. Believing you're fat even though you're severely underweight, denial that your body needs more food than you're giving it, and distorted, unjustifiable beliefs about your bodily image, which result in not eating, are examples of negative cognition symptoms. For biological, I have serotonin and dopamine are two neurotransmitters that can affect how people think and behave. These same neurotransmitters, if imbalanced, can lead to a risk of developing anorexia. People with too much serotonin are put in this continual state of stress, but when they starve themselves, they tend to feel better because it decreases the serotonin in their brains. People with an overproduction of dopamine leads them to have anxiety and avoid enjoyable things like eating. For psychological, I have self-oriented perfectionism is when you set high, unrealistic standards for yourself and being critical of yourself when the standards aren't met. It's a thought process that you must always be perfect in any way. This can cause anorexia because if you are a perfectionist about your body, you could potentially develop a fear of gaining weight when you feel as if your body is overweight. For social cultural, I have activities are one of many factors that can lead to anorexia due to the stereotypical image of the perfect person fit for certain activities. For example, ballet coaches focus on appearance to choose who they want in their clubs or not. This could lead to anorexia because dancers who don't meet the specific body weight tend to starve themselves to look more appealing to the coaches. For risk group, I have anorexia is primarily affecting women, although anyone could develop it, due to social cultural factors like the stereotypical ideal body a woman should have and the comparisons to other women who may have that idealized body type. This pressures women into thinking they need to be slim to be accepted in society, which puts women at a higher risk for anorexia. For biomedical treatments, I have antidepressants. Antidepressants are prescribed medication to treat primary depression. It eases symptoms, but it isn't proven to actually fix the root causes. Antidepressants can be used to ease depressive symptoms of anorexia, but it can't make the depression go away fully. They can regulate the brain's neurotransmitters like serotonin and dopamine, which can stop the negative actions of starvation and food avoidance over time. This can progressively help people recover from anorexia, but cannot fully grant its extinction. For talk treatment, I have client-centered therapy. Client-centered therapy is very helpful because it allows for the client to see themselves more clearly. Therapists during this therapy offer unconditional support, positivity, and create a judge-free zone for you to feel comfortable to share your feelings. People with anorexia tend to have symptoms of low self-esteem, self-oriented perfectionism, harsh self-criticism, shame, and fear of judgment. CCT provides people with anorexia a safe place to talk about their disorder and targets the negative symptoms of anorexia. The negative symptoms are then replaced with positivity and self-acceptance. For active treatments, I have cognitive behavioral therapy. It is an individual treatment specified to treat your specific needs. CBT connects the thoughts and the actions that contribute to your eating disorder. The idea that your thoughts influence your actions. So in CBT, you focus on thoughts that are harming you and try to change and overcome them. By connecting thoughts to actions and changing various factors for a more positive outcome, this active treatment attacks the dysfunctional eating behaviors. And by doing so, it provides insights to the patient while also replacing the harmful thoughts with positive ones. This will in turn create better actions of eating healthier and getting back to a healthy body weight. These are my citations. Thank you.